Good day. Are you ready to invest for a safer smile? You're in luck because Smile Safe has got you covered. Good day, everyone. I am Andrea, and together with my group, Alikpala Calada, Concepcion, Forcam, Katangay, and Manalo, we are presenting our project Smile Safe, a clinical decision support system for dental triage. Together, we have collaborated to develop a solution that aims to transform dental triage systems by enhancing accuracy, efficiency, and patient centered care. Our project focuses on streamlining workflows for dental professionals while ensuring patient safety through innovative technology. Today, we will walk you through the details of SmileSafe, including its objectives, methodology, technical features, and the potential impact it will have on the dental practices. Now, with us, you will have safe smiles with SmileSafe.
To give a background on the problem, so generally the first encounter that a patient would have in a dental clinic is the reception area wherein they would be triaged. The role of a triage system in patient care is crucial for the proper record of vital signs and initial chief complaint, which will serve as the information that can aid in the assessment of factors like the complexity of a case, the need for special equipment, and the medical history that could complicate the drugs to be prescribed. However, at present, there is no requirement for a dental team to undertake any official triage training, making some clinics not have a standard triage system to begin with. And alternatively, some assistants do have knowledge on triage systems, but there is no proper interpretation of data and risk assessment. Patients would have to wait until they are attended by their dentist for such. Then, for a number of causes, patients may present as emergency patients. Because those cases could be complex, the amount of time consumed for settling an emergency appointment can increase indefinitely without a proper system managing it. Additionally, studies also show that although technology has been incorporated into the field of dentistry for long over a decade now, these systems are typically only for administrative functions, such as billing and electronic patient health records. At most, they can automate tasks like set reminders for appointments. But although these help with the efficiency under different aspects of a dental workflow, there is still a crucial lack of a system for triaging patients, especially for determining emergency cases and their appropriate health risk assessments.
We present SmileSafe, a clinical decision support system for dental triage. This is designed to enhance dental clinics' triage processes, especially for emergency patients. It assists the dental assistants by evaluating the patient's chief complaint, basic information, vital signs, and medical history to assess their risk levels or to determine if they should be rescheduled. By integrating existing medical knowledge, SmileSafe generates tailored medical advice and suggests minor procedural adjustments to mitigate identified risks. This system enables dentists to provide more patient centered treatment and care effectively.
The SmileSafe, a clinical decision support system for dental triage, aims to enhance dental triage by improving patient data collection, risk assessment, and decision making. The system gathers vital patient information such as medical history, vital signs, allergies, and current conditions, which dental assistants will analyze to prioritize urgent cases. Built using a waterfall methodology, the system integrates clinical guidelines and ensures compliance with the Philippine Data Privacy Act. Oracle will provide survey information, and Google Cloud will manage data storage and access. The project involves software engineers, healthcare experts, and subject matter specialists to design risk algorithms and improve the system. Collaborations with UPCD, DOH, and PCHRD will offer expertise and funding, and while customer support team will assist with technical issues. The system aims to improve dental triage, ensure patient-centered care, and support practitioners in making informed decisions during clinic hours for patients needing dental treatment.
For the beneficiaries of this project, SmileSafe may improve patient care by providing accurate diagnosis and personalized treatment plans. Dentists will also benefit this dynamic triage system by allowing them to provide timely care and enhance patient satisfaction. The UP College of Dentistry, as well as Philippine government agencies like the Department of Health and the Philippine Council for Health Research and Development, may sponsor this project by providing financial and technical support to develop and implement SmileSafe given their funding, facilities, and personal needs. Lastly, dentists, dental companies, and associations are the key stakeholders of SmileSafe as their feedback and support will help improve the system and its adoption to dental clinics.
For its vision statement, SmileSafe envisions itself to become a world renowned clinical decision support system used by dental clinics and professionals internationally, promoting patient safety across the globe. SmileSafe will be a tool that will stand along the front lines of dentistry towards a modernized and revolutionized clinical practice. Guided by its core principles, efficiency, safety, and dynamics, SmileSafe will become a trailblazer in paving the way for a balanced integration of technology in creating tailor fit treatment procedures for each patient. As the profession continues to evolve, SmileSafe will be able to empower dental professionals and bring confidence to every patient as it aims to be a tool where efficiency meets safety.
It is our mission statement that SmileSafe Clinical Decision Support System for dental triage is driven by the following aims and values. First is to provide optimal and accurate analysis of patients' vital signs, improving the efficiency of the patient triage system as well as ensuring data integrity essential for proper clinical diagnosis development. To improve overall oral well-being and enhance patient outcomes by equipping dental practitioners with accurate and comprehensive vital sign assessments and creating tailor-fit and patient-centered treatment plans. And finally, to substantially decrease the imposing risks brought upon by vital sign abnormalities in dental procedures by providing accurate and timely patient vital sign analysis, empowering dental professionals in conducting early medical intervention in line with current evidence-based decision making.
As SmileSafe aims to be a trailblazer in a future where efficiency meets safety, its main objective is to streamline the process of treatment planning through assisted interpretation of patients' medical information, thus providing personalized care with minimized risks. Breaking this down to more specific objectives, the system strives to interpret recorded vital signs and address the implications these may have on treatment, to detect and alert the dentist on any abnormal vital signs that could compromise the procedure, to evaluate the risk for complications that may be encountered based on the patient's medical history and vital signs, to help the dentist prepare for any possible adjustments based on the CDSS's assessment, and to alert cases that may need immediate medical attention.
We now move on to the feasibility assessment portion, wherein both TELOS and SWOT analysis were used, but this presentation will cover only the TELOS feasibility findings. So first up for technical, the modernization of protocols in the dental workflow such as the triage system will surely be of great help with CDSS, especially given the technology and research available in our world today. But although timely, it still entails a costly shift from conventional to digital methods. SmileSafe requires computers to be mandated in every clinic that shall use it due to the need of having to download the software application. At least one computer in the reception area and another computer for the dentist themselves. As the system may also encounter possible software or hardware errors, there must be a way to swiftly resolve these issues. Unless someone in the clinic is knowledgeable enough to diagnose and fix the problem, developers must be available for contact at times that they are needed. The system is also fairly easy to use, as it is simply more on inputting patient information, then the system will do all the work of providing alerts on possible emergencies, complications, and the adjustments needed. With this, age-related problems on the usage of technology could still arise but seem manageable. For economic, it is not only costly for the shift from conventional to digital, but it is also costly for the integration and maintenance of the system itself. Issues like crashes and bugs will require the need for frequent software updates. Thus, to fund this, SmileSafe features an option for a paid subscription. However, this also means that user experience must be greatly ensured. If clinics are not satisfied with the application, especially the subscribers of the paid feature, then it could mean less revenue for the company, posing a challenge on software maintenance. We move on to legislative. No current guidelines from the American Dental Association are put for CDSS, but issues on the legality of SmileSafe could arise from a data breach as the system is purely digital, especially the cloud-based subscription feature of the software. Thus, dentists and dental staff alike are to be reminded of the Data Privacy Act of 2012, which upholds the fundamental right of every individual to protect the information they share. Also, under the Code of Ethics for Medical Professionals, all patients must be given the same amount of care regardless of their background. Thus, and most importantly, no discrimination must be given to patients who present with certain conditions upon initial consultation in the reception area. For operational, SmileSafe can reduce the stress dealt by dental staff by providing a more efficient system, especially for when there is an influx of patients and emergency cases. Staff will then receive training on both the technology and proper triage protocols for supplementary understanding on the whole system. Lastly, as the system's maintenance is heavily anchored on user experience, staff's compliance on requests for feedback are needed by developers for software improvement. And lastly, for schedule, the system entails a long development time since a lot of factors must be considered, such as accuracy, reliability, safe data storage, and being user-friendly. The need to adhere with universal policies under both technology and medicine could also further prolong this development.
Presented in the slide is a conceptual model of the SmileSafe CDSS. The identified users that will benefit and interact with the system are the patient, dental assistant, and dentist. If you can observe in the model being presented, the patient will only be an indirect user of the system as they will only provide the necessary information needed to the dental assistant. The entirety of the relationships between the identified users and the system are pretty self-explanatory. However, for a more in-depth discussion about each users and their relationships with the system, you may scan the QR code provided in the slide to access our project proposal document. Now flashed on your screen are the result categories that could be generated to the dental assistant. Low and moderate risk will indicate that the patient could undergo the procedure with little to no modifications in procedures. High risk status will suggest further evaluation with the dentist as it has already noted several red flags. Under the status is also the subcategory for emergency cases, wherein clinic personnel will be alerted with the immediacy of the patient's cases, allowing them to execute emergency protocols set in place in their respective clinics. Last result category is reschedule. This schedule will appear if the patient is unsuited to undergo procedures as of the moment. This would include patients who currently have high blood pressure, severe fever, symptoms of viral infectious diseases, and etc.
Despite triaging having a key role in identifying patients in need of urgent care, there is currently no set standard for triaging patients before dental procedures. This may be due to the lack of professional clinical training and background of administrative staff. Even dental assistants who in the Philippines have no specific educational requirement needed for the job. However, there have been some studies, such as one conducted by Hegi 2019, that assess the effectiveness of reception-led triage system implementation in general practice. They found that triage systems for accommodation of emergency patients can improve patient outcomes, allowing the clinic to provide more efficient care. SmileSafe not only offers similar services, but it adds to it by granting the administrator the ability to digitally log other patient data such as medical history and vital sign records all in one space, and then taking it one step further by using this information to provide an initial analysis on the urgency of dental care needed, considering any systemic or underlying conditions that may interfere with the procedure. In doing so, it provides a more uniform way of organizing and storing patient data, as well as assist the dentist in making clinical decisions that they can use as further reference in following dental visits. Through these key features, SmileSafe will be able to enhance the screening process, all while hopefully emphasizing the need for more standard procedures on patient assessment prior to dental treatment.
The SmileSafe CDSS shall utilize the principles of the waterfall development methodology. This methodology will follow a linear and sequential approach to the system's development life cycle, or the SDLC, allowing for a logical progression for the project. The waterfall methodology will follow successive stages of requirements, design, implementation, verification, and maintenance, wherein each stage would concentrate on certain objectives, each of which must be finished in its entirety before moving on to the next. Presented in the slide is the expected outcomes or output at each phase of the development process. Further details about each stage are again available in our project proposal document, which you can scan again through the QR code provided below. During requirements gathering and analysis, it is expected that we will be able to gather data through interviews and surveys. It is also during this stage where TILE's feasibility studies will be conducted, which will be very crucial for the succeeding phases of the project. After the requirements gathering and analysis, we have the system design phase, which shall produce a data process flow as well as the design specification document, which will include specifics about the programming language, hardware, data sources, software architecture, and services that will be created. The third phase of the development will be the implementation phase, which will primarily be responsible for the construction of the software itself. It will primarily produce the source code, which will serve as the foundation for succeeding coding developments. This phase of the project will be carried out by our own team of developers and pool of domain experts. All databases, algorithms, and user interface shall be developed in house. However, as for infrastructures needed for server and cloud storage, the team would acquire the service of Oracle and Google respectively. Once the prototype of the software is created, a test run prior to the succeeding stage will be conducted. The fourth stage before public release will be validation, which will comprise of systems and beta testing, as well as usability study, which will be further discussed later. Lastly, upon the release of the software publicly, the fifth stage shall commence, which shall provide continued client support and service improvement through patches and updates. SmileSafe shall be deployed as a downloadable desktop software for dental clinics. It shall include basic features of interpreting vital signs, risk assessment, and emergency evaluation. Interpretation of vital signs would further allow the system to check for any possible complications with the procedure to be conducted and identify possible red flags based on the abnormal vital signs. Risk assessment would include evaluation of risk for complications of patients based on their vital signs as well as their medical history. Through this, the system could suggest the substitution of materials in which patients have allergies and modification of procedure and treatment plan to minimize the risk. Lastly, an emergency evaluation would notify dentists and dental staff to immediately accommodate patients with urgent concerns. Such feature would allow the dental team to implement protocols or measures to handle potential emergencies caused by complications such as but not limited to allergic reactions, heart problems, and respiratory problems. The software bundle can be downloaded through its official website at www.smilesafe.com. There are two packages offered for the acquisition of the system: a standard and premium package. The standard package includes all the basic features of the system previously discussed. All data and result records would be temporarily stored for 1 week and would be automatically deleted from the system for data privacy and storage limitations. On the other hand, the premium package would include access to a cloud storage for the safekeeping of all result records. Such a feature would allow dentists to review previous protocols and methods of patient care done for recall patients. However, unlike the standard package, the premium package would be billed annually for maintenance purposes of the cloud's storage system.
SmileSafe shall utilize remote evaluation methods in determining usability. Both synchronous and asynchronous modalities shall be implemented as the team coordinates with a population of dentists to enable them to test the system in their own clinics throughout a certain period. The participants will be oriented synchronously through Zoom to guide them through the system, and a soft copy of the manual along with the team's contacts, will also be provided should any issue or confusion arise during the trial. Since the clinical testing itself will be unmoderated, it is imperative that the participants are fully informed on how to operate the software to ensure feedback validity and accuracy. Afterwards, the dentist will be entrusted to apply the system in their own clinics, and after the testing period, they will be recontacted to undergo individual online interviews where they will be asked to detail their personal experience and express their thoughts on SmileSafe's effectiveness in aiding the professional clinical decision-making process. To determine the program's success after its official public launch, a feedback form will be available on the software's homepage so users can readily forward any reviews, comments, and/or suggestions as they see fit. Pop-up surveys asking them to rate user experience shall also appear periodically to check in on user satisfaction. Data acquired from these sources will be used as reference for any future updates and continual improvement of the services SmileSafe provides.
For the project's resources, vital indicators like blood pressure, pulse, temperature, and respiration rate alongside medical history are key data inputs for the system. These ensure decision-making aligns with clinical guidelines from organizations like ADA while adhering to privacy laws such as the Philippine Data Privacy Act. The team will collaborate with domain experts to build the system's knowledge base complementing their developers. Oracle Server's infrastructure and Google Cloud Services will support the system with prototypes tested to ensure smooth integration of all components. SmileSafe's development follows a waterfall methodology for its process, with clear phases including requirements gathering, design, implementation, testing, and deployment. Pilot testing in clinics and simulated data validation will ensure system accuracy and usability. The project aims to create a CDSS that enhances patient safety, streamlines dental triage, and empowers dental professionals with actionable insights. It will enable accurate risk evaluation and prioritize urgent cases through seamless data collection and real-time results. And the team will include developers, designers, SMEs like dentists to design and validate clinical algorithms. Project managers, trainers, and customer support teams will also ensure smooth implementation, user training, and ongoing system support. Using the waterfall methodology also for its management, each phase will be complemented sequentially. Ensuring a structured approach, project managers will oversee progress, align goals with stakeholders like UPCD, and ensure clinical relevance and timely delivery. And lastly, for the other resources, partnerships with institutions like the DOH and UPCD will provide funding, expertise, and promotional support. Feedback mechanisms, including surveys and focus groups, will guide system improvements while a support team ensures operational continuity.
The constraints of the project may be divided into three: by scope, time, and cost constraints. The project has several limitations in terms of its scope. Notably, the system primarily focuses on three vital signs, namely temperature, blood pressure, and pulse rate. While these are essential for routine screening, incorporating additional vital signs could enhance the system's effectiveness. The core of the system relies heavily on the accuracy and correctness of the inputted data. If the data is inaccurate, it may compromise the overall reliability of the system's output. Moreover, since this is a clinical decision support system made specifically for dentistry, it may be overly specialized, which could be limiting given the interconnected nature of dentistry with other medical fields. For the time constraints, the development of the system will be lengthy, considering the complexity and intricacy of the output we desire to attain. Similar to most healthcare technologies, it will most likely face delays, as it will undergo rigorous testing and evaluations to ensure its effectiveness and reliability. Lastly, for cost constraints, this project will definitely be very expensive. This project will need the expertise of people in different fields such as dentistry, general medicine, computer science, and health research. These people must be paid for their services somehow. On the screen is a Gantt chart for us to better visualize the project timeline. It provides us with a summary of the tasks outlining their corresponding phases, start and end dates, and the duration of each task. For Phase 1, we have the requirements phase. It consists of data gathering, feasibility studies, and finalizing system requirements, which will take 56 weeks. Next, for Phase 2, the design phase, including prototyping and project revisions, taking 51 weeks. Next, for Phase 3 is the implementation phase, which consists of developing a software test plan as well as the creation of user manuals, which will take up to 136 weeks, and this is the longest phase of the development process. For Phase 4, we have the verification phase, which includes software testing, and under software testing, we have unit testing, integration testing, user acceptance, staff training, system deployment, which overall will take 63 weeks. And lastly, for Phase 5 maintenance, we have 152 weeks for the initial maintenance. Afterwards, the maintenance personnel will only be called if the user faces troubles with the system.
In conclusion, SmileSafe can automatically analyze the patient's data, essential for risk identification and intervention recommendations, ensuring patients with urgent needs to receive timely attention according to their chief complaint. SmileSafe, as a clinical decision support system, empowers dentists by providing efficient, safe, and optimal patient-centered dental care. With accurate patient screening and vital sign analysis, it would aid in creating a patient-specific treatment approach and a comprehensive risk categorization essential in the identification of any medical comorbidity interactions.
Kalidad Bakama? Look no further. Choose SmileSafe, a state-of-the-art clinical decision support system with the goal of having a modernized clinical practice through delivering dynamic, patient-centered treatment and care. SmileSafe is not just a technological innovation, but is a beacon creating a safer, more efficient, and patient-centered dental industry. So let's bring out the inner confidence, one smile at a time, with SmileSafe, where efficiency meets safety and quality is just one click away. Once again, this is SmileSafe. Thank you so much for listening.